care. New data shows 1 in 6 of the most critically ill patients in hospital in the UK are pregnant and unvaccinated. Well, let's talk this through with Dr. Robert Kim-Farley, who's Professor of UCLA's Fielding School of Public Health, joining us live from Los Angeles. Welcome to the programme. That's data we've gathered here in the UK. What's the situation in America with regards to pregnant mums?
Well, pregnant women are certainly at higher risk here in the United States as well. There's been 127,000 cases, lab-confirmed cases, 22,000 hospitalizations, and 171 deaths. I think one figure, Sally, is that 97% of the women in hospitals have been unvaccinated that are pregnant.
All right. And why the reluctance to get the vaccine?
I think at the beginning it was a little bit unknown. But as of the 11th of August, the Center for Disease Control and Prevention, our CDC here in the United States, strongly recommended vaccination. There's been 3 safety monitoring systems looking at vaccine in pregnant women, finding that it's safe and effective, and recognizing this toll that is taking on pregnant women and their newborns, by the way, really now strongly recommending pregnant women be vaccinated to protect themselves and their fetus and newborns.
Yeah, so of course what you're saying is the risk is far greater of catching COVID when pregnant than having the vaccine to prevent serious illness if you do get COVID.
Exactly right.
And so what's, the step forward on this? Because clearly it is a real problem and, as you say, can have serious consequences for the mum and the baby.
Yes, you're right, Sally, that we're still struggling here in the United States. One of the lowest groups, in fact, for vaccination coverage has been pregnant women, with about 26% of pregnant women in the United States have received 1 or more doses of vaccine. So it's something that we now have to do a bit of catch up on. And I think that you here, there in the UK as well, to get to this group now recognized as a high priority because they suffer the problems of high rates of hospitalizations, high rates of serious disease, and even death.
And in terms of the difference the vaccination program has made in the US, where has it made a real difference? And where do you see some states in the US where they're still reluctant to go ahead with vaccines?
I think the real difference has been made, especially in the elderly, which we knew early on were at most high risk of serious disease and death. So that group is the most highly vaccinated at this time. I think the challenge for us has been the varied responses by state and even locality in the United States, where there's even been situations where we've had governors in some states issuing bans on mask use. So completely the antithesis, if you will, of good public health control measures.
Okay, Dr. Robert Kim-Farley, thank you for being on the programme.